Let's talk today about something most people don't understand about the back end portion of prior authorization. And it's this: usually, for at least a major insurance carrier, the decision to approve or to deny your care is not being made by the insurance carrier. It's actually being handled by a third party company whose whole job is to review medical requests. There's a big investigation that I've got a link to. It just took a closer look at how that works. Let's dive into it. This is Unsolved, probably your 5 or 6 Medicare Minute. Okay, so let's dive right into this then. So a recent ProPublica report came out that dug into one of the biggest players in this prior authorization space. There's a company called Evicore, Evicore. Now, what they do is they review prior authorization requests from several of the major health insurance carriers in the nation. Now, prior authorization is not something new. We've covered it several times on this channel. It has been around for decades, right? The goal of prior authorization to help make sure that the treatment you're getting is medically necessary, to prevent low value or duplicate care, and to help control costs around the entire healthcare expanse or the system itself. So the concept then of prior authorization is not evil. It's part of how healthcare is managed and how they manage risk. However, where the ProPublica report focused was how these reviews were being managed on the back end or operationally. ProPublica alleges that internal systems may have influenced which cases were flagged for deeper review, and that some of their employees felt pressure to keep denials from actually being overturned. The article also highlighted situations where doctors said they felt that the process on the back end slowed down or even blocked care that they believed was appropriate or medically necessary. And to be fair, insurers and review companies say that they follow clinical guidelines and that final decisions are made by licensed clinicians, not software, which is important. We don't want software determining who gets to live and who doesn't, or who gets surgery and who doesn't. That's not fair. We want a human eye on it. And if you're on an MA plan right now, you already know prior authorization is a part of the game. It's part of the structure that you're in. If you're on traditional Medicare, prior authorization hasn't been used as much, but we're seeing it expand, at least in certain areas. So this conversation's not going away. This sphere of influence is only growing. In fact, absolutely, I would suggest to you it's going to continue growing. Okay, now let me pause before I go any further because I want seniors and agents both to hear this, especially if they've ever been frustrated by the world of prior authorization, right? While ProPublica alleges that Evicore was unfairly denying care, the other side, Evicore, says, hey, we followed all the clinical standards. So instead of taking any sides, right, here's the reality I want you to be prepared for. Sometimes prior authorizations get approved quickly. It's no problem to it. In fact, within a few days, they could be approved. Sometimes they get sent back for more documentation. Could be on the medical biller's problem where they didn't put everything correctly, or it could be on the side of the companies that are denying. Sometimes it just gets denied even when your doctor believes it should be covered. And that can feel scary, and I understand that, especially when we're talking about something that involves x-rays, MRIs, CT scans, cancer treatment, heart procedures, or pain management therapy, or some major surgery. So instead of giving all this scare tactics, let's talk about what you can do. If something comes back denied, that's not the end of the story for you, at least not on the first count. Here's the process you should follow. Slowly and calmly, step by step, call your doctor's office. Not call the insurance company up front. Call the doctor's office, because the doctor's the one who inevitably will submit an appeal. The doctor's documentation is what matters most up front, all right? Ask then what medical necessity was clearly explained in the original documentation. You know, a lot of denials happen because the notes didn't match the insurance carrier's policy wording correctly, not because you didn't need the care, all right? So we called the doctor. We've asked about medical necessary items, necessity maybe. Ask whether a peer-to-peer review is available. That means that your doctor can get on the phone and talk directly with the clinician who's on staff for the insurance carrier. And then keep every letter and every EOB that you have in a little folder. You'll thank yourself later if you have a diagnosis that someone's coming back and saying you've never been diagnosed. Okay, and finally, my last step, stay calm, Okay, there's nothing you could do running around like a chicken with its head cut off that's going to help anything, if that even makes sense to you. Many cases do get approved on appeal once the right documentation has been satisfied or submitted. And I want to also point out some of the key points from the ProPublica report in normal human language to you, right? Firstly, they reported that some review companies market themselves as quote unquote helping insurers reduce cost. You know what that means? It means denying care is a part of the savings. I don't like that language. Secondly, they cited several examples where doctors felt medically appropriate care was delayed. And then in states like Arkansas, where denial data has to legally be disclosed, denial rates were significantly higher reported than the national MA average. In fact, 20% in one area. But, and this is important, the companies deny having denial quotas and say that clinicians make the final call and that reviews are following all the clinical policy that they're required to. So there's two sides of the story. You've got doctors and patients who obviously want fewer hoops, right, to jump through. And then you've got plans that want unnecessary spending. And I agree to both of those things. Review companies then are caught somewhere in the middle. And somewhere in all that, you've got real people like you and me and our members that are waiting on real care. And that's the reality of where we're at. So here's the bottom line then. If you're on traditional Medicare or if you are on a Medicare Advantage plan today, prior authorization, it's just part of the system. Sometimes it protects you from risky or unnecessary care. Sometimes it ends up delaying care that feels clearly needed. And it's not necessarily the insurance carrier always. There are third-party companies that are being hired out to approve or deny. And as these news stories come out, expect more oversight, expect more scrutiny, not less. This is going to become a more popular topic than it's ever been. And honestly, oversight is healthy. It makes the system better for everybody. Once again, my goal is not to scare anybody. I'm not here to attack a company or to take sides. My goal is simple, to help you as an agent understand and interpret how the system really works so that you can communicate honestly to your members, and that will help families know what to do when something feels stuck.